Hello, and welcome to Eating for Life, the Power of Lifestyle Medicine and Nutrition. My name is Claudia Zerlini, and I'm the Manager of Programs and Digital Content in the HSS Education Institute. We are pleased to welcome you to the fourth installation of our Lifestyle Medicine webinar series. Our discussion will start with the lifestyle medicine approach. We will hear from our panelists about what differentiates the lifestyle medicine approach from other diets and food trends. We will also discuss how food contributes to inflammation and chronic disease in the body. And finally, we'll talk about ways to incorporate a lifestyle medicine approach to food in your own life. I am pleased to introduce our panelists this evening for our discussion. Joining us is Dr. Heidi Prather, who is a physiatrist at Hospitals for Special Surgery and board certified in physical medicine and rehabilitation and sports medicine, and a diplomat of the American Board of Lifestyle Medicine. She serves as the founder and medical director of the HSS Lifestyle Medicine program. She has practiced non-operative musculoskeletal medicine for nearly 3 decades and enjoys clinical work, teaching, and research. Frustrated with the healthcare system's limitations in healthcare provider collaboration and patient access to services needed to improve their musculoskeletal health, she developed the HSS Lifestyle Medicine program to enable a focus on whole person health. Practicing lifestyle medicine has given her hope and energy to be involved in healthcare, not sick care. Joining us as well is Sue Yu, who is a clinical nutritionist at Hospital for Special Surgery. She is a graduate of New York University with a Master of Science degree in clinical nutrition. She is a certified diabetes care education specialist and holds a certificate in training on adult weight management. At Hospital for Special Surgery, Sue works with patients with spine, hip, knee, and shoulder disorders, rheumatoid arthritis, scleroderma, lupus, and diabetes in the inpatient setting. Currently, she is the chief outpatient dietitian at the hospital and has consulted patients in the lifestyle medicine program. Thank you both for joining us this evening, and let's dive right in with our first question and point of discussion. What is lifestyle medicine and how is it different from conventional medicine? And why is nutrition especially an important pillar? Dr. Prather, we'll start with you.
The difference between typical conventional medicine is somebody comes to me and I'm seeing them for their back pain or their knee pain. And in traditional conventional medicine, we do a history and exam. And I recommend something that typically that you might be a passive recipient of, meaning you just absorb it and do what we ask, or take a pill or have an injection or procedure. In lifestyle medicine, it's the exact reverse. I'm the cheerleader, and I'm the person trying to give education and information to folks so that they know how to improve little things and sometimes big things in their lifestyle that can help them get healthier. Why? And most of this has been addressed in the endocrine world, so that's the diabetes world, has had a lot of input and literature into this, into the development of lifestyle medicine. The other medical specialties that have put a lot of evidence based into this is the cardiac world. So traditionally, lifestyle medicine is something that you see a lot of folks in primary care apply to help improve health in patients. As a musculoskeletal provider for almost 30 years, I got pretty frustrated with what I was doing every day, which was giving a pill. I was incentivized by the healthcare system I work for, which at the time was not HSS, but I was incentivized by them to do more to people. I even got questioned if I did less to people, right? There is no incentive for me to educate somebody about being healthy. The system makes money off of poor health. So that became circular. I'll get the word right. And I came up with the idea that we need to apply the same principles of how to get healthier to folks with musculoskeletal medicine. And I was dreaming this up around the time that the American College of Lifestyle Medicine started putting out formatting for this. I wish I had dreamed it up after they put it out. That would save me some time, but as they were developing their formatting for this type of programming, I was dreaming it up on my own, and eventually got a program up and going. And that program has now seen about 1,000 patients, a lot of which had long COVID, and they recently won an award from Dr. Fauci. So wonderful. I then came to HSS, and HSS is extremely interested in helping people get healthier related to their musculoskeletal health. And we've developed a program here that's now up and going, and to the point that the pilot program works so well that we're now offering it almost mandated for some patients at high risk prior to surgery. But we'll see anybody prior to surgery. So what is that's a long-winded story for how do we apply something that came from the diabetes and cardiac world to musculoskeletal medicine? Well, the reason why is they're rooted in the same cause, which is systemic inflammation, which means that low-grade inflammation that's all over your system. We think 63% of people in the United States that have osteoarthritis have it because they have a metabolic condition that's serving that arthritis to develop and progress. So the same thing that can help progress osteoarthritis or develop the development of osteoarthritis can be used to treat it, which is to reverse that metabolic imbalance that you have. So lifestyle medicine, and in shorter terms, is the application of lifestyle changes. There are 6 pillars of health. Those include nutrition, physical activity, sleep health, reducing stress, magnifying the importance of social connection, which people really understand better now after the pandemic, and avoiding risky substances. Nutrition is really one of they're all important, and they're all geared towards reducing inflammation. Nutrition's, I think, important for a couple of reasons. One, some of it's new. It's a new concept to people. We've all lived through a lot of fad diets and know they didn't work. And part of that was the fact that our government, which is where we get a lot of our big funding for research, didn't fund nutrition well, right? We funded new things and this specialty and that specialty, didn't necessarily pay enough attention to nutrition. And out of this body of work from those in the endocrine world and the cardiac world, it kind of came from the grassroots up. And now we've got about 20 years of data that shows this is the right thing to do. So that's one thing. And I know we're going to talk about different diets tonight, but just know this is where the evidence is to helping prevent, reverse, and treat chronic disease. I think the other reason why it's such an important pillar is it's one of the basic things. What we eat is one of the basic root causes of why we develop oxidative stress and systemic inflammation. So if we can even change it a little bit, we don't have to, it's a different kind of nutritional aspect. It's not like you have to eat all in one direction or eat very restrictive in one way. If you adapt even 20% of the principles, you get 20% benefit. And most diets that we've all learned about in the past, you really had to adhere to just that, or you weren't going to be necessarily successful. So again, lifestyle medicine is evidence-based. It encompasses all 6 pillars because all 6 pillars contribute to systemic inflammation. And it's really about adapting a lifestyle and not something that's restrictive.
Thank you so much for that overview. And you referenced this a bit, but I wanted to dive into it a little further because a quick Google search even of nutrition reveals many nutrition-related articles. 10 nutrition myths experts wish would go away. The science of what we eat is failing us. 10 diets to try tomorrow to lose 20 pounds. Whatever it is, but there's tons of research and articles on coffee, wine, dark chocolate, fad diets, what time you eat, the amount you eat. And it can really be difficult to follow or determine reliability. So can you speak to a little bit the landscape of nutrition information and how we've come to understand what is healthful to eat or to not eat?
Yeah, I'm sure Sue is giggling because people come to her with all kinds of different questions. So the big thing, and we need Sue to speak to this as well, but the big thing is everybody needs something unique to them. And we've got to find what that right answer is for that person. But the lifestyle medicine approach, which is using whole food, plant predominant eating, is the one that shows the best evidence towards reducing chronic disease, right? And again, obesity and type 2 diabetes in our country are rampant, and a lot of it is related to our Western diet. So that's pretty simple there. I think the other issue as a physician is that, and I haven't had as much training as Sue. I've had extra training, but I haven't had as much training as Sue, obviously, is that unfortunately we've broken apart parts of our food as a society. Like, oh, vitamin C is good. So we dive into, oh, I need to have this much vitamin C. Oh, protein is good. Protein is everything. Well, for some people, protein means meat. To me, protein means protein. I eat beans, right? So, there's all these, we have language that's not consistent. We've kind of broken apart our food as instead of thinking it of as a whole package. And I think that's where a lot of our inconsistencies have come. I'm sure Sue can tell us some stories.
Oh, absolutely. I think, Dr. Prather have really hit a bullseye there. I think our society is so broken up into focusing on one macronutrient, one area of food, rather than incorporating a well-balanced meal plan. We are not talking about like how to incorporate different aspects of different food groups into our diets, but more like, okay, you know what, let's do the Atkins diet, or let's do the keto diet, because that will help you solve in certain areas. But most of the time I've seen a lot of my patients who come to see me is that those are not feasible or sustainable diet to follow for long terms, or they're not meant to be followed for long terms. Well, oftentimes those diets lack so many other nutrients that it becomes problematic, and I think, our society is just so quick to pinpoint, to find a quick solutions to things that oftentimes it just does not work. And having this lifestyle medicine compensating like different areas of fruits and vegetables and plant-based eating does help, and it does work, and it can be followed for long term as a very healthy lifestyle behavioral change, rather than just aim at just focusing on one particular area that oftentimes we know that it just doesn't work that way, and our body doesn't function that way. We do need different areas of nutrition, different nutrients to support health.
You referenced some diets that, I've heard of and that I'm sure a lot of our audience have heard of. So could you describe, Dr. Prather, maybe start, and then Sue, feel free to add, the difference between some of these diets that we might be aware of in kind of our public consciousness, like keto, whole food, plant-based, vegetarian, lacto-ovo-vegetarian, and what way of eating does the lifestyle medicine adhere to?
I'll start with the basics, and Sue will fill in the specifics. So whole food plant-based eating, or plant predominant eating, is eating the whole food. So blueberry juice is not so great for us because we've squeezed the fiber out of the blueberry. And oftentimes in the United States, we've added sugar or other flavorings and even things I can't pronounce into the ingredient. And for some people, that's what makes it taste good. But if I eat the whole blueberry, that's very good for me because it's intact. It's the whole package of food. And what's so important about it is fiber. And fiber is the key to one of the big key factors into longevity and health. It's what helps us get our gut biome, which is good and bad bacteria. We have this trillions of bacteria in our gut, and it's got to be balanced. When that's balanced, we have improved health. Fiber is a big contributor to the making of short chain fatty acids, which again are made in our gut, and they are big promoters of health. So when we don't have fiber, we lose a lot of the advantages of the parts that we just talked about when we split up the parts of the food that would be beneficial to us. So again, eating the whole food, like the whole blueberry, is good, but squeezing the fiber out of it and eating it as juice is not so as healthy for us. And the only thing that has fiber in it is plants. And so that's why eating in the direction of eating more plants is great. I think you said so yeah, still, so that's still eating, lacto-ovo is still eating fish and dairy that goes with that. Fish is, we know fish can be great for us, but the way we get the great nutrition out of the fish is what the fish eats off the bottom of whatever floor they're in, whether it's a fresh lake, a fresh river, or the ocean. Our farm-fed fish, right, that get all those fillers or whatever fed to them, that fish is not going to be as good for us as one that's fresh. So it's kind of a conduit again to a plant. The dairy piece of it, dairy is quite inflammatory. We weren't necessarily meant to eat cow's milk. If you think about the reverse is not happening. So it's something that's been promoted in society, but if you look at the actual properties of it, it is quite inflammatory. So again, when we're working on systemic chronic diseases that are rooted in inflammation, it's one of those things that having less of it can be, helpful to health. I would do want to say, I think Sue will talk about, I hope Sue will talk about keto and paleo because they're so trendy right now. The one thing I do want to make sure people know is whole food plant-based or plant predominant eating is very different than vegan. So whole food plant predominant is eating the whole food, the real food, not processed food. Predominant means a lot of plants and going in the direction you want about 50% of your plate to be vegetables and fruit, another quarter of it to be grains and seeds, and another quarter of it to be legumes or beans. Herbs and spices mixed in with all that. That's kind of the ideal plate. Vegan is avoiding dairy and avoiding meat. Sometimes it's based on social reasons for not being harmful to animals. But a ding dong and a Dorito are both vegan and they're not so great for us. So that's really, we have to make sure people understand the difference in those.
Absolutely. So I want to dive into, I know there's so many popularity. I mean, so much popularity in eating a keto diet. There's so many patients who come to me in exploring about doing a keto diet because they have friends or relatives who are on it and have good success rate in losing weight. So what is a keto diet? A keto diet is predominantly fat-based intake. I mean, we're talking about eating tons of saturated fats in there. And by the way, keto diet is actually come about decades ago to treat seizure disorder. Patients who are having uncontrolled epilepsy, like seizure disorders, eating a high-fat diet actually prevents having episode or flare-ups of having seizures. So those diets are actually medically prescribed for a medical reason, and it's not supposedly prescribed for people who want to lose weight. It come about, the popularity comes about because people realize that for any diet, what of the fat diet is that when you so restricted in just eating one area of food, you will lose weight. But it's not a healthy way to do it because just like a keto diet, you will eat a tons of like animal fats and saturated fat like butter and bacon, which is not so healthy, right? I have a lot of patients. Just recently, I have a gentleman who followed a keto diet and he was losing weight. But you know what? His cholesterol level bloomed up into like uncontrolled, unhealthy, unsafe level. I had to beg him to stop it. I'm like, you are killing yourself slowly if you continue to do so. That's not the right way of eating and it's not right for him. All right. So it might solve one issue. He was losing weight on it, but it's really increasing his cardiovascular health, which is increasing his cholesterol level. And that's not so great, right? So, teaching patients to incorporate how to eat healthily, incorporating those whole foods, right? Incorporating the plants, the vegetables, and the fruits into their diet, or teaching them how to incorporate eating whole grains, right? Having whole wheat bread versus white bread. What does that to your weight status as well as to your glucose control? Because having fiber is just such a critical thing in there to help, not just to help us to regulate our sugar level, but also, like Dr. Prather mentioned earlier, about our gut microbiome. Those good bacteria in our gut are so dependent on fiber for fuel. I have so many patients who come to see me like, oh, I'm doing so great. I'm taking my probiotic supplements. This is so wonderful. I'm all set. I don't need to eat vegetables. They don't realize that you can take all the probiotics you want. You are not feeding those bacteria with food. They will die. It doesn't matter how many probiotics you take. It just is not beneficial if you're not eating the food that's supposed to be fueling them, that they feed on, make them grow and replicate in your own guts. So this is all go back to about plant-based eating, right? How helpful and important it is, because it really plays into different aspects of our health. Is really about, there's so many research out there emphasizing about our gut microbiome, which is the different bacteria in our gut, and how that leads to chronic diseases such as type 2 diabetes, heart disease, and cancer. And the research has shown it's really amazing to look at like a person with diabetes compared to a person without diabetes, and just looking at the gut, what type of bacteria or lack of bacteria are in those guts. And it's just so critical that those patients who have type 2 diabetes oftentimes lack many different types of different strain of bacteria that they will find in versus a healthy individual without diabetes. So it all plays into our diet, right? What we eat. It really is, what you are is really, who you are is what you eat, really. Because your health really depends on the food choices or the food selections that you make.
To add to that, we talk about, like you were talking about your patient who's slowly killing, you're worried he's slowly killing himself, but it's silent, right? He doesn't feel it yet. He sees something in the mirror, and unfortunately society rewards that, right? We reward that pretty well. But think of this as a fact that processed meat like sausage, I hate to offend whatever ethnic group that eats a lot of sausage here, but sausage is a processed red meat. And if you look at the carcinogen, which means its ability to cause cancer, is equal to that of smoking. Now, we all know smoking is something we try to avoid to do because of the severe risk of cancer with it. Sausage is rated at the same level of a carcinogen as a cigarette. So heavy diets in that can be not just have bad blood pressure and, have heart disease someday, it can kill you. And that's probably where some of the relationships are to cancers and nutrition.
Wow.
Absolutely.
That's a profound comparison.
Yes. Eat something different on your pizza next time.
Just not pineapple.
Yeah, exactly.
I am very curious to know, so you mentioned fiber a lot, and Dr. Prather, you've talked about that a bit, and I often see fiber supplements available. Can you talk a little bit about supplementation versus whole foods, and how those might either work together or work against each other?
Yeah, there's really no substitute for the real thing. So if your gut biome imbalanced, and now you put in a fiber that's not packaged as the whole food, you don't get the real benefit out of it as you do with eating the blueberry. I'll keep going back to the blueberry. They just don't, your body doesn't absorb it, doesn't use it. I think maybe Sue even talked about the fads of prebiotics and probiotics. I mean, we do use them in medical instances with people with very specific disorders, but in general, it's better to do it with real food.
Absolutely. And those supplementation is, you never know where those substances are being derived from. And our gut microbiome, the bacteria in our gut, are just not dependent on just one type of food or one strain of fiber. It's like moldable, and you get those moldable different type of nutrients in food. You know, you're not going to get the completion in supplementation. So is supplementation a bad thing to take? Not really. You know, some people do need to take supplementation for different disorders. But the majority of us, we do need to emphasize and using food as medicine, really emphasizing on eating our food, because we can get complete nutrition, all the vitamins, all the minerals, just by eating our food source.
Right. So just to play off that, if I think I need more vitamin D, which I think I do, I live in New York. We don't have sun, very much of it between like November-ish and February here. And that's where, you know, if we're at work, we don't get into the sunshine, which is where we get our vitamin D. But if I take in no other sources of vitamin D, I actually won't absorb the supplement. The supplement has to bind to something that's already there, that's a like nature, to then be absorbed into your system. So taking a handful of supplements, but not eating what's in the supplement itself as a natural food, it negates the whole process, and you just end up having expensive pee and poop, because that's how we get rid of it. And so that's just another like tidbit take home is, if you do need supplements, make sure you are getting it in a natural food way so you get the best advantage of it.
Always think of food first before supplements if you can, you know, because we can be very healthy by just looking at the food that we eat and the choices that we make.
Definitely. Many people use dieting to focus on a number on a scale, to lose weight or to look a certain way. Can you talk a bit about how lifestyle medicine might shift this perspective and what changes you can expect to see when you start a whole food plant-based diet?
Yeah, I get sent a lot of patients. I'll ask them, well, what did your doctor say when they said, come see me? And I have some people very scared. They're afraid. They've had a weight problem for a lot of years. They've tried things. There can be shame with that. There's culture with that. There's anxiety with it. There's all kinds of things. I'm thinking, wow, I'm not that scary person, but it's really interesting to see how much this impacts people. And so I listen to hear what they perceive they're there for. And then we say, okay, I know they may have talked to you about your weight, but this is not a weight loss program. This is a program that tries to address systemic inflammation in your body for your whole global health. And oh, by the way, if we do that, you're probably going to lose some weight. And we'll talk about, specific ways that may help you do that, even more to an advantage eating in this direction. But a lot of times when people just make a big shift and reduce inflammation, that's when they start to see their efforts of weight loss to actually improve. The other thing is the thing that's different about lifestyle medicine, one, it's all evidence-based, but two is that it's not just what you eat and how much you exercise, right? And that's usually been the prescription for weight loss, is just those two things. So I had a gentleman in the program, and he was losing weight, and then he'd plateau, and then he was losing weight, and he was really frustrated. He came, I am eating the right things, I am really adherent and I am exercising and I'm not losing weight every week. I said, okay, well, that means you're really doing good on those two things. What are the other 4 pillars of lifestyle medicine that maybe we could work on to see if that helped? And he figured out within under a week, he figured out the weeks he didn't sleep well were the weeks he didn't lose weight. Poor sleep health increases our inflammatory level, which makes all the efforts towards reducing inflammation that lead to weight loss, it can negate it. So if you're struggling with that, that's, to me, that's one of the big differences of lifestyle medicine is that for some people, the byproduct of it will be weight loss. And if that's somebody's focus, we'll make sure we talk about eating less calorie dense foods. But if it's really done in the right way, it's not something you count calories for forever or that type of thing, because you're kind of eating in a direction that's healthy in your body. As long as it's got fiber in it, can take care of it.
I think for me, it's like looking at the lifestyle medicine is really more like a detective, right? Like really look into the underlying cause of the problem. Having high blood pressure, what causes the high blood pressure? Let's dive into that, and work on really solving the root cause of the problem. The root cause might be stress management, maybe that might lead to the high blood pressure. Oftentimes I have patients like, I'm eating really well, like I don't add salt to my food, but yet I still have uncontrolled hypertension. Why is that? Why is my blood pressure is so uncontrolled? Is maybe perhaps it's just stress level is so high, So I think lifestyle medicine is really, it's just such a great way of looking at medicine, because we're not just focusing on here's a pill, you go home, you take this medicine and you'll be done with, your blood pressure will be well controlled. No, we're actually looking at what is the root cause of it and how to solve that for you.
I really like that blood pressure example, because someone actually put in the Q&A that they're 77, they're vegan, they do cardio exercise, they teach yoga and meditation for the past 30 years, but their blood pressure is still high. Is there ever a point where hypertension is hypertension? And can lifestyle medicine cure all disease?
It doesn't cure all of it, but it definitely can help manage it. So think about, everybody needs something different. So if that person were to sit with Sue would probably pull apart the diet, like what we think we're doing good may not be good for us, and or as an individual, maybe you have food sensitivities, maybe there's something underlying that. If you have a pain problem as a musculoskeletal physician, I think that drives a lot of things. It's really interesting in the lifestyle medicine program, the folks that come in that are on their way to having a joint replacement. They're trying to get healthy prior to joint replacement. And they have bone-on-bone knee arthritis, and they have 0 physical activity minutes per week. Your goal is to be somewhere between 75 intense or 150 to 300 non-intense cumulative minutes over a week's time. They have 0. 49% of the people in the program have 0 because they can't move. And their pain levels are very high. And when we take their inflammatory marker from their bloodstream, if I was just in regular clinic, I'd be looking for infection because it's so high. And it's really interesting to watch that if we start to get their nutrition better, their sleep health better, managing stress, their physical activity can actually go up. And we see pain levels go down and the C-reactive protein or the inflammatory marker goes down. And I always wonder, it's got to be this combination of things. It's not one thing. And I think that's why it works so well, is because we're addressing all those different aspects. We're having people go from 0 minutes of physical activity prior to joint replacement up to 100 minutes of physical activity per week. And we've seen pain levels go from 7 out of 10, with 10 being the worst you've ever experienced, down to 2. That's prior to joint replacement. You're going to do better with a knee replacement if you're rolling in to get it done with less pain and moving more. That's a known fact. So but I really think it's because we get to simultaneously address it with all the different factors.
Right. And sometimes, you know, even for me, it's like when I seeing a patient who is vegetarian or vegan, is I do dive in really deeply into what they eat. I mean, being a vegan or vegetarian might not necessarily a healthy thing to eat based on what they're eating, their food choices, right? I have one particular patient who is a vegan, but she eats tons of packaged food. She relies on, instead of getting her protein from beans and nuts and seeds, you know, she relies on getting protein on all packaged protein food. You know, so her sodium intake is extremely high as a result of those fake meats. She called them fake meats. And she's eating a lot of them. That's her diet. And so that's why sometimes we just have to be very careful into, you know, based on sometimes eating a vegan diet or having a vegan packaged meal might not be very healthy depending how that meal is prepared.
Yeah, I think that's so important to remember too, because we often just associate, oh, vegan, healthy, you know, or this person's very health conscious. But that might not always be the case. Um, how do we get started? You know, we might have limited time, budget, motivation. How do we actually start eating a whole food, plant predominant diet?
Yeah, I think simple steps like if it's got a mother or a face, eat less of that. If you're going to the grocery store, it's got more than 5 ingredients or anything you don't know what it is, don't buy it. Maybe you start with something even simpler. Give up soda. Soda is really bad for us. You know, or the sugar, the this, but it's got a lot of like processed stuff in it too. I'm a recovering Diet Dr. Pepper addict, right? For about a decade when my children were growing up, because I grew up in a house with Tab because my mom thought it was healthier for me because I had less sugar. You would put a chocolate cake in front of me or a Diet Dr. Pepper in front of me, and I would grab the Diet Dr. Pepper every time. And to the point where I noticed I was craving it. I'm like, what is going on here? Like my brain is changing. Like this probably isn't good, right? And this is right before the evolution of the sweeteners and that type of thing was coming out. Finally, we had some science that said stay away from this stuff. But it was really interesting. So I had to go cold turkey, which I did. And about 6 weeks later, I was given a cup of something that I thought was water, and it was really a Diet Dr. Pepper. And I drank it, and it tasted terrible. So it was really interesting how when you make changes, and it was really quick. In fact, the literature shows that you can make changes in your taste buds in as little as 10 days, right? You fix the craving real well when it doesn't taste good and there's no joy in it anymore, right? That hit my brain needed to get the dopamine going no longer exists. So that's just an example, but you may find that one thing and make it the lowest hanging fruit. The thing is like, oh, that's too easy, I can do it. That's the thing to start with. Because once you've done that, then you do the next one, and the next one, you want your goals to be achievable and timely and something very doable.
Absolutely. And always, I'm sorry.
Oh, I was going to say, not completely throwing out the pantry in one go.
No, I mean, some people, when they start learning about it and they get excited about it and they've read some books about it, that's exactly what they do. But you got to test the water to figure out how far you can really go. And for some people, Mediterranean diet is where they stick. It's got lots of good evidence about it being anti-inflammatory. The meat part of that's in a Mediterranean diet is all lean meat. If you eat meat that's organic or not grass-fed and fish that's fresh, all those things help your gut biome. It's kind of in that same vein. Everybody's got to go to where they want to be. But again, eating just in that direction there's health benefits, even if you do 10%.
Yeah, I agree with that. I think start gradual. You don't have to change your diet completely. If there's in one area where you're like, okay, you know what, my goal is to improve or increase my vegetable intake. If that is the case, start out with one vegetable that you like to eat. I just like today, I saw a patient, she was like, last month we're talking about having vegetables, incorporating she never liked vegetables. She's in her 50s. She hates vegetables. She doesn't want to touch vegetables. So, and last month we're talking about, okay, you know what? Find a vegetable that you are willing to try. Just give it a shot. Just try it out. And she was like, you know what? String beans. I love it. I'm gonna incorporate that. That's the only thing that I'm willing to try for this month. I'm like, oh, I'm so happy. And she did. She tried it. I saw her today and she's like, Sue, I hate string beans now because I'm so tired of it for eating it every single day for a month. I'm like, let's work out trying other vegetables. What other vegetables are you willing to add? Because that's her goal, right? Her goal is to trying to work with us to add some vegetables in there. And she's like, cabbage. I love cabbage. I'm willing to do that. I'm like, great. Why don't you add cabbage, but don't have it every day? Try to have cabbage every other day or every 2 days. And the other days you might trying to have the string beans again, so that you don't get so tired of eating the same thing. So the whole point is, find a way that works for you, setting goals for yourself. I think finding goals on what area that you want to improve and identifying that area for yourself is important. And then perhaps that's how we're going to guide you in achieving that goal.
Great tips. I mean, when I learned how to roast vegetables, that was a game changer for me. I grew up with boiled vegetables and if you asked me to eat more, I'd probably say I'm not too keen on that. But, I think it comes down to two, like how are you preparing the string beans? How are you preparing the cabbage? There are a couple of really good questions in the chat, and I think that they're important to address. There are a couple about dairy and osteoporosis. Can you chat a little bit about how a whole food plant-based diet can support osteoporosis or not, and how you might either supplement or use dairy to help build strong bones?
I think, vitamin D supplementation is probably is pretty important for everyone, especially pale complected females not living in the sun. we're just genetically at greater risk for that. Checking your vitamin D level is the thing I would encourage people to do to really know if you are low or not and to supplement. And that's one of the key factors for bone health. Also know that if your vitamin D level is low, your muscles will hurt, you'll feel fatigued, you're achier easily. I mean, there's some pain benefits from making sure your vitamin D level is high. Calcium, really important to have calcium. The jury keeps changing on how important it is with our actual bone health. The thing about bone health is that's an area of medicine that really just continues to evolve. We've got so many more. When I was in med school, Fosamax came out after I was in med. That was our first drug we ever had for it. So it's still, and I've only been out about 30 years. So over 30 years, we've seen a huge change in that. And I think we're going to continue. Now it's important to have calcium, and you can get those from green leafies. Salmon, if you're eating fish, is another great source of it. Broccoli. All of those things are high in calcium. Vitamin D we get from the sun. So either be in the sun and or take a supplement is probably pretty important.
Yeah, people don't realize that you can actually get a large quantity of calcium by eating leafy greens. For instance, having a half a cup of cooked Swiss chard or half a cup of cooked collard greens, that already provides you 100 milligrams of calcium in just half a cup. And if I show my patient what a half a cup of cooked vegetable looks like, they all be like, oh my God, I'm eating 3 to 4 times that much on a regular meal, regular basis. So we can easily get our calcium needs based on the food choices just by eating plant-based foods. The leafy greens has good source of it. Almonds, people don't realize that almond naturally contains calcium, as well as sweet potatoes. Those are good food to eat, and they're high in fiber, right? going back to our guts, that's something that supports the bacteria in our gut is by eating those food. Another thing is like there's certain fruits out there that are excellent source of calcium that we might not know of, such as like, for instance, figs. Who knew that 5 figs gives us 135 milligrams of calcium? So things of that sort, that we don't need to rely on dairy products in order to get calcium needs. And we can absolutely be able to get adequate calcium based on plant-based food.